My speech is about teen pregnancies, how to prevent them, and how to help teens come to parents to help them with them. I am also going to be talking about the signs and how they can get help if they're nervous or if they just don't feel very confident. In the past 10 years, there has been pregnancy rates of 67.8% out of 1,000. And nowadays, last 2-3 years, pregnancy rates in teens have went down, but not very much. About 17 out of 1,000. Well, some of the signs of being pregnant, which all teens think that being pregnant is so cool and so fascinating, which is not so thrilling, is morning sickness, fatigue, which is tiring, cravings, which some are not always good, and of course your missed period. And once further down the line, when you're pregnant, is usually going to the bathroom a lot, which of course the baby is on your bladder most of the time. And a lot of pregnancies don't have these symptoms, but some do. Now with me, I had all. And it's not the most fun in the world. Further along in the pregnancy, there's some complications with teen pregnancies. Some of them are dealing with high blood pressure, which is preeclampsia, which is not very good. It tends to lead to low birth weight, miscarriages, or stillborn babies. My sister had this when she was pregnant, and it's where the blood pressure goes really, really high, and it cuts off the oxygen to the baby, or it will lower the birth rate, which will go down to like 34 weeks, and will really hurt with the lungs and the heart and the brain of the infant. Not all teen pregnancies get these, but most do. Another problem with teen pregnancies is mature birth, which I mentioned this earlier, which can be really, really bad. A normal pregnancy birth is 40 weeks. A premature birth is 37. I ended up having a 37-week pregnancy, but I had twins, which was early. Some of the problems with having a premature baby is respiratory, which is the lungs, digestive system, the vision, and plenty more. So make sure, if you're pregnant, make sure you take all your vitamins, which is prenatals, folic acid, and always make sure you have your daily checkups. Now, some teen pregnancies tend to get this, but not all. It's pronounced postpartum depression, or PPD. This occurs when teen pregnancies don't always go as well as they think. Yeah, they get all the attention when they're pregnant and all the attention when the baby comes, but after the baby get here, the attention's on the baby and the mother feels like they're left out. Or another sign is where the mother starts losing weight while she's pregnant, and she thinks she can't go along with it, so she ends up having a miscarriage, or she ends up having bleeding during her pregnancy. Now, there are a couple of things that could prevent this, which is getting help from counselors, doctors, or even asking their parents to help. The best safe way is to go to a doctor, have the checkup, make sure everything's okay with the baby and the mother. Now the big risk. The big risk is telling the parents. All teens are always scared about telling their parents that they're pregnant. Which, yeah, at first they're gonna scream, ask what were they thinking, why did they do it? And a lot of teens are scared of this. Yeah, at first parents are going to be scared as well as the teens, and they're going to scream. Just give it time. They'll get over it and they'll calm down. But at first, they're only thinking of the teen's best behavior and best of the baby. They're going to ask questions like, how are you going to raise it? Parents are always not going to be there to help. They're going to think it's your child, you should take care of it. But they will help no matter what they say. When it comes to drugs, alcohol, cigarettes, yeah, everybody says don't do drugs and alcohol, which that's common sense with teens. You don't do that. It hurts the baby, of course. Cigarettes, some pregnant women do smoke while they are pregnant. It gives low birth weight, and low when it comes to the respiratory system and stuff. It makes everything low, like their heart rate and how they breathe and stuff. But it's not always the case. So try not to smoke drugs or alcohol or any of that. Now the fun part, which all teens are always thinking about. The clothes, the beds, and all this. Yeah, that stuff is fun, but from a child being born to a child to be 18, it cost over $18,000. And just think, that's school, that's clothes, that's the little odds and ends, that's food, that's diapers. Then there's the crying every 2 hours at night. Then unless you get the good baby, then sometimes they wait for 3 hours, but not all babies do. But there's always the little chance that you think, yeah, you're going to be the best mother in the world. All new mothers are scared at first, no matter which way they go. I was scared. When a baby cried and you've changed the diaper and fed them and burped them and rocked them and they still cry, sometimes the best thing is to cry right beside them. But the best thing to do is be patient. Always be patient with the baby. They're not all fun and games like everybody says. They're time consuming. They need a little bit of everything. So when teens think that they're going to get pregnant, or think about, yeah, I think I'm ready for sex, always double check your references. Babies are fun, but it's not fun raising them sometimes. Sometimes you get the little mistakes. But always remember, be patient. There's no rush. That's why teens should wait to be pregnant.